Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. Today I'm joined by Dr. Lawrence Lowe, our Medical Officer of Health for Peel Region, Paul Morrison, our Director of Bylaw Enforcement and Commissioner of Legislative Services. I'm also joined today by Regional Councillor Rowena Santos, who will provide an update on International Women's Day and how the city is celebrating this year, and also the impacts on women in our community with COVID-19. Before we begin, I want to recognize the help from the provincial government for transit. Just yesterday, the provincial government announced $150 million for municipal transit systems, and for Brampton, we're going to be getting $23.4 million up until December 31st, 2021, and that's important. During the height of the pandemic, transit ridership was down 90%, and we've made an effort to maintain our transit routes because we have so many essential workers that need to get to their place of work, and this partnership with the provincial government ensures that there are not going to be deficits in transit in 2021. So thank you to the provincial government and our local minister, Pramit Sarkaria. I also wanted to give an update today on vaccines. Very encouraged that the Osler Health System has got off the ground running with an appointment system, an online appointment system. At one point yesterday, we had 6,000 appointments booked over 2 hours. The uptake and interest amongst our seniors has been phenomenal. And so right now, with the supply we've been given, we are vaccinating those 80 years of age and older, or those who will be turning 80 in 2021. This is in addition to the other high priority populations that the hospital is currently vaccinating. As of today, Osler has administered more than 17,200 doses of the Pfizer BioNTech COVID-19 vaccine. This includes nearly 500 residents age 80 and older since this weekend at the Shinkuzi Wellness Center, which is a municipal facility we made available for the purpose of helping with the vaccination effort. And I want to share one story. I went by the vaccination center yesterday, and boy was it well run. Really impressed with Dr. Naveed Mohammed and his team at Osler Health. Really well run. No one was waiting outside. There was physical distancing. It was a fast and an effective machine that was set up to vaccinate seniors in our community. But I went there partly because I wanted to accompany our former Premier of Ontario, Bill Davis, to get his COVID-19 vaccine. And I can tell you, he can still outcharm and outwit anyone around. He wanted to ask every person working where they lived, if they lived in Brampton, because obviously he's proud of Brampton. He even wanted to shake the police officers' hands to thank them for their service, which obviously we can't do during COVID. But it's great to see role models in our community like him get vaccinated, because they're now on their way to protection. And that's why it's so important we get the supply so we can vaccinate our seniors, and it's great to see this in progress. I also want to share an update from Osler on their current capacity. Right now there are 30 COVID-19 inpatients at Brampton Civic, including 2 in the ICU. So this is encouraging. The ICU capacity is better than it's been in months. There are an additional 20 COVID-19 suspect patients awaiting test results at Brampton Civic. In total, Osler has completed 266,979 COVID-19 tests to date. That's, I just have to say, that's an impressive number. Thank you, Osler. In terms of the vaccine rollout, we have set up the infrastructure locally that as we get supply, we're going to be able to hit the ground running. When there's supply for those under 80, the infrastructure is there. As of February 2021, there are 3 Peel Public Health COVID-19 vaccination centers in Brampton supporting vaccine delivery. Residents 80 years and over will be asked to go to specific vaccine clinics in Peel. Appointments are necessary at all clinics. Walk-ins are not permitted. Right now we have clinics at the Region of Peel offices, 10 Peel Centre Drive, the Save Max Sports Centre, formerly the Brampton Soccer Centre at 1495 Sandalwood Parkway East, and the Chris Gibson Recreation Centre. And obviously, as more vaccine supply becomes available, they'll be looking at additional means in which vaccines can be provided. There's already talk about how AstraZeneca will be delivered differently. I also wanted to reference that yesterday we had a small business roundtable with Dr. Lowe. We had 58 small businesses who have all had their doors closed because of lockdown provisions, and I'm very mindful that our small businesses are hurting. I want to thank Dr. Lowe for taking the time to answer their questions, to hear their concerns. We know that this isn't just a health pandemic, it's an economic firestorm for them, and it is my hope. It is my hope as soon as possible we can get their doors open again, and so we can get the recovery afoot. In terms of a bylaw update, there was only 3 charges this week under the mandatory face covering bylaw. 19 charges were under the Reopening of Ontario Act, 2 charges under the Emergency Management and Civil Protection Act, and 1 charge under the licensing bylaw. So overall, once again, a high level of compliance, and thank you, Brampton, for understanding the importance of being consistent with the public health rules. So on that note, I'm going to call up Councillor Santos for the International Women's Day update, and then Dr. Lowe for the Peel Public Health update.
Thank you, Mayor Brown, and good morning, everyone. In lead up to International Women's Day on Monday, March the 8th, it is so important that we continue that conversation around achieving full gender equality, especially in the context of this global pandemic. International Women's Day celebrates the social, economic, cultural, and political achievements of women, and it also marks a call to action for accelerating women's equality. COVID-19 has amplified many of the existing gaps in our systems that need our continued focus and action. Women in the first wave of this pandemic were disproportionately affected. So let's acknowledge that as we continue to push that a gender pay gap still exists in this country, which makes this pandemic financially harder on women. And also, many of our essential workers are women, many of whom do not have access to paid sick days. We need paid sick days. We must also recognize that fundamental to achieving transformative change is the safety and well-being of women. Between economic and social stressors, coupled with stay-at-home measures, gender-based violence still remains a serious concern in our community. We have seen firsthand here in the region of Peel. According to Peel Police, the highest number of calls that they receive are based on family and intimate partner violence. In 2020 alone, Peel Police reported 5,431 violations related to domestic disputes and disturbances in Brampton, and 4,165 violations related to family disputes and disturbances. These numbers are not okay, and it's why, together with the region of Peel, we launched an awareness campaign titled, "It's Not Okay." I want to take this moment to share, if you or someone you know needs support, please know that you could call 211 24 hours a day, 7 days a week. And if this matter is an emergency or life-threatening, make sure to call 911. This morning, I would also like to recognize the women in our organization and community who are rising up and taking their place at decision-making tables to actively make space, safe space. From our women leaders who have been driving our COVID-19 social support task force throughout the pandemic, and to the women leading our emergency response and economic recovery, to the women on the front lines who have been keeping our city safe and moving. We see you, you are fierce, you are courageous, you are unstoppable, and thank you. You have all contributed to building a safer and more sustainable and resilient community and economy, and I look forward to building on your work as we together recently announced the Equity Office in Brampton. As this year's International Women's Day theme is Choose to Challenge, I encourage everyone to choose to challenge the status quo. We all share the responsibility in creating a gender-equal world, and together we will close those gaps, remove barriers, and shatter those glass ceilings. Thank you so much, and back to you, Mr. Mayor.
It's my pleasure now to ask Dr. Lowe to share his update in regards to Peel Public Health.
Thank you, Mr. Mayor, Councillor Santos. Good morning, everyone. This week, Brampton's test positivity is at 8.7%, which is up from 7.4% last week. Our weekly incidence rate is at 128.1 cases per 100,000, which is up from 115.1 cases per 100,000 last week. This week, we hit a milestone worth celebrating. Online registration for vaccination started for residents 80 and older at our 2 hospital sites in the region of Peel, and some residents have already gotten vaccinated. I want to thank our hospital partners, and in Brampton specifically, our partners at William Osler, for their partnership and collaboration in offering this protection to this important group in our community. I also want to say that while appointments are limited in supply, I am glad that we have been able to start one small step in vaccinating and providing protection to all of our residents, starting with our oldest and most vulnerable. I also urge patience. If you can't get an appointment right away, please try again. More appointments will become available as more supply is received. The future is bright, and I know that we all want to get back to normal. The vaccines are one part, though it is really your sacrifices to date that have got us part of the way there. Unfortunately, we are seeing a reversal of the favorable trends that we've observed in the last 5 weeks, and this is driven by the growth of variants of concern and the loosening of measures in other jurisdictions. From 5 cases just 2 weeks ago, we now have over 100 confirmed cases of confirmed variants in our community and 600 that have screened positive. And these numbers give me pause. In this race between vaccine and variants, we know that we have limited vaccine supply at this time and rapidly accelerating variants. Our hospitals are also seeing admissions related to spread of variants, and while ICU occupancy has improved from the peak of the second wave, they still remain at levels similar to what we saw in Wave 1 in spring 2020. Reopening too quickly risks erasing the gains that we've made, putting lives and well-being at risk. The UK saw a third wave when they reopened with variants in their midst, and nobody, myself included, wants to see that. We must try to keep what happened there from happening here. That is why I encourage us strongly to reopen gradually. We don't want to have to use the provincial emergency brake as Simcoe, Muskoka, and Thunder Bay did. For our schools, for our elderly, and especially for our businesses that are hurting and need certainty. Like you, as we continue to gradually open, I want us to stay open. That is why, as we exit the province's stay-at-home order, I am recommending that we enter the province's response framework under gray for a 2-week period. This does permit a gradual reopening of certain sectors in our community. And I know it may be hard to hear for some, but our indicators still remain somewhat precarious, and it makes it difficult to recommend any other level. For Peel businesses, I want you to know that I understand how your sacrifices have protected not only Peel, but residents across Ontario from COVID-19. You have borne a disproportionate burden and sacrifice, and I hope that in due time this is recognized and given support through additional resources. Please know that if conditions allowed, I would absolutely recommend loosening measures more quickly, like I did in July 2020. But now is not the time. We need to open gradually and hold on just a while longer while we get in more vaccines to cover our population. I want to thank also all of you who have stayed home and supported local here in Peel as well. And for those of you who are traveling to other regions, know this. If you contract COVID in another jurisdiction outside of Peel, you will count as a Peel resident in our case counts, making it harder for all of us to move on. So let's make sure the vaccines win this race. Please, continue to do your best to stay apart and stay home as much as possible, especially as better days are just around the corner. Thank you, and I'll pass it back to Mayor Brown.
Okay, so now it's time for some questions. The first question is Graham Frisk from the Brampton Guardian.
Good morning, guys. How's it going? My first question would be, I think both questions today would be for Mayor Brown. I'm just curious. You mentioned that the provinces provided some additional funding to put towards transit. I'm just curious, what are the total COVID losses, like financial losses for the city to this point, when you include everything?
So I can speak to last year. Last year, because of the Safe Restart Agreement, we were almost even. There was a slight loss, but we were almost made whole thanks to the federal and provincial Safe Restart Agreement. This year, it's premature to say, but hopefully with this transit funding, we're going to be in pretty good shape to hopefully be whole again this year. There are some other costs, and obviously at a regional level, we'd have to look at additional public health costs. And it depends how much longer the lockdown continues. When there's a lockdown, there's losses for the city. Our facilities are closed, but we still have operating costs. You can't rent them. But I'm optimistic that we've got a great partnership with the federal and provincial governments that will be okay by the end of the year.
Great. Now, you also mentioned there earlier that 58 small businesses have closed in Brampton so far. What can the city do to help them reopen? I mean, what sort of options are being explored in that regard?
So it wasn't 58 businesses that had closed. It was 58 businesses that we had a round table with that had closed as part of the lockdown provisions, but they hadn't closed down operations. They were simply closed as part of the lockdown. In terms of helping them, my goal is to help them safely restart. There are not a lot of municipal tools. Municipalities are not allowed to provide subsidies for for-profit governments. That's prohibited. For for-profit companies, that's prohibited under the Municipal Act, but we are trying to do everything we can, deferring property taxes, trying to make sure we advocate for the federal and provincial programs like rent relief, like wage subsidies, but it's tough. Frankly, all the programs that exist, it's not adequate for the losses that businesses are facing. They're losing clientele, they're losing sweat equity that they put into their company. I'm really worried about our small businesses. This has been a really, really tough period. Our next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. I'm just wondering how you feel about giving the AstraZeneca vaccine to seniors.
Thanks so much for the question, Irene. Certainly the evidence continues to evolve. At this point in time, my understanding is the National Advisory Committee for Immunization does not recommend that it be used for 65 plus, but we do know that that is not on the basis of anything around harm, but just an absence of data, as I understand it. I do understand that there is more real-world data available now, especially from other countries where AstraZeneca was used from that population, and so certainly I will continue to await and defer to my federal counterparts and experts there as to the uses and indications. So I respect whatever they come up with, whatever they come up with now, and we'll continue to monitor. Thanks so much for the question.
My follow-up, Mississauga's mayor has wanted to reopen in the red. Dr. Lowe, you're recommending gray. Is there a way to split reopening in Peel, that perhaps Mississauga is red and Brampton gray?
So thank you very much for the question, Irene. I am mandated under provincial legislation to provide my recommendations within the health unit boundaries that I serve. There is a recognition that our communities are very interconnected. There's also a recognition that the healthcare systems are also very interconnected. This is, while I do know that there has been provincial precedents previously for splitting a region, my understanding is that was a very specific, unique situation around migrant worker farms in Windsor, Essex. Unfortunately, this is this is not necessarily the situation we see here, and I continue to have to speak to the mandate of the whole health unit that I serve. Thank you very much.
And Irene, I would just add to that that if you look at the case counts, the Brampton has a higher case count than Mississauga, but the variant outbreak was in Mississauga. That was one of the reasons that we were held back from the initial reopening. And you have to look at the severity of the cases. The severity of the cases have been significantly higher in Mississauga. The number of fatalities have been significantly higher. And so this talk about whether you can separate Peel Region doesn't really make sense, because we are completely interconnected. Our hospitals are interconnected. Our communities are interconnected. And Mayor Crombie and myself both felt and tried to give our best encouragement to public health that we felt our communities were ready to reopen. But ultimately, it is a public health decision, not a political decision, and we have to respect the decision of public health. Our next question is Sabrina from Mississauga News.
Hi there. My question is for Dr. Lowe. So, Dr. Lowe, you said it would be best for Peel Region to enter the gray zone for 2 weeks. What would be the best scenario to happen during those 2 weeks that could eventually lead to the region entering the red zone?
One of the things that I would like to see is obviously that our case counts and our reproductive number are not on the uptrend again. We are seeing a slight bump. I'm hoping that that's just a slight bump in the viral dynamics, but it could also reflect the changes in community interaction around the school opening, and certainly is also related to the variants of concern. I think also, as long as our hospitals continue to see improvements in their capacity, and as long as our vaccine capacity and the availability continues to increase, I am hopeful that we will, as we continue to move gradually and as the weather gets better, start to see an exit from all of this altogether permanently. Thanks.
Thanks. And so my follow-up question would be, so if we do enter the gray zone and we stay there for 2 weeks and cases go up, would you recommend us going back into the complete lockdown?
So as I understand it from our provincial partners, that was a specific stay-at-home order that was made under the emergency provisions, and I would have to defer to the province as to what would be possible. At this point in time, I am hopeful and optimistic that we will continue to see either holding or improving trends that may allow us to continue moving further. No one wants to see this, end and exit more than me, I would say. I know small business owners are hurting. I know everyone's hurting. I want people to know that I'm here respecting my mandate and my professional opinion, and it's not the news that people want to hear, but I do have the same hope and optimism that with more vaccine, better weather, and hopefully a little more time, we'll continue to exit out of this altogether. Thanks.
Okay, Nitin Chopra from Prime Asia TV.
Good morning to all. My question is to Mayor Brown, or Paul Morrison can also add into this. Last weekend we saw huge gatherings in Shoppers World Plaza, rallies, protests. Every weekend we see that in Brampton and Peel. Many of them were without mask and breaking the social distancing. We are in 2 stay-at-home orders into the Peel. We talked to police also in this regard, and they passed every buck to city's bylaw. So my question is, why law is different for different people? When people were socializing at their home, they got tickets. Can you let us know how many tickets being issued in these rallies or these gatherings? What is the role of bylaw, and what do you think about these clashes, violence, protests? And what can we do to stop this kind of division in the communities? Thank you.
Well, thank you for the question, Nitin. And I did see videos of the protests this weekend. I should say, first of all, that there's been a number of protests on different issues over the last few weeks, and we're not supposed to have protests during a lockdown. We're not supposed to have protests during a stay-at-home order. I know there is significant controversy over international events, but we really do plead with the public to, when there's a stay-at-home order, to limit their exposure with others unless it's for essential purposes. I also want to add that I saw footage of violence in one of the protests, and there's no tolerance for that. This is a country where we proudly protect our charter, our right to protest, and the notion that anyone would face violence or intimidation or threats is abhorrent. And I'm glad, I understand the police are investigating that, and it's appropriate that they do. In terms of the role of bylaw, bylaw doesn't have the tools or the resources or the capacity to enforce protest. That would be a responsibility of the police, and Paul Morrison, our Director of Bylaw Enforcement, can explain that.
Thank you, Nitin. I can tell you that we're pretty aggressive at trying to work hard ensuring that the public is educated not to have these protests. But when they do deem that they're going to have one, we do share this information with Peel Regional Police, and we do meet with them on a regular basis, advising them of the potential of the incidents, the potential of violence that may take place there. And we rely on the police. In bylaw, our role is primarily parking enforcement, property standards enforcement, and licensing enforcement. The province enacting the regulations has asked us to step up and do something that's not common to us, nor are we equipped to handle when there's scenes of violence. We are officers who wear shirt and pants. We don't have protective vests. We don't have protective belts that have tools to help us out. So when we go to these protests, we have to consider the safety of our officers, Premier, and the safety of the public as well. So we rely on the police to go to these. They are well equipped, they are trained, and they are well informed to deal with these protests. We provide them with the ability to use our city bylaws. We write them right into our bylaws so they can enforce them. They have the ability to enforce the provincial regulations. They have their own powers under the Police Services Act. So for those reasons, we do look to them to be the lead in these situations.
I have a follow-up for Dr. Lowe. Dr. Lowe, rallies and protests we saw under stay-at-home orders, these are allowed and everybody is doing that. Do you think these huge gatherings which we saw on Sunday in the parking lots, they spread the virus?
From a scientific perspective, we do continue to discourage any sort of gathering with individuals outside of one's household. But I do recognize, certainly the emotions and the desire to express. And so we always say, if there's an essential reason for you to be at your household, please make sure you're doing it with distancing, with masking, with limiting numbers as much as you can. And so I think that's all I'll have to say about that. Thank you very much.
Okay, we have time for one last question because our council meeting is just starting. So I'm going to go to the last question. Nikki Cedrone from the Bramptonist.
Hi, good morning, Mayor Brown. This question is for you. As the province moves into color zones and Brampton remains locked down, region hopping continues to be a concern. Can you comment on this?
Yeah, I am very concerned. I've said a number of times I don't think you can split apart the GTA. The reality is we are an interconnected region. The mayors in the GTA have access to cell phone data which shows where people are moving. You see their mobility, and when you lock down part of the GTA and not the other parts of the GTA, what you see is massive migration of residents. And so in Scarborough, you've got residents going up to Markham for dining and open retail. In Brampton, you see migration to Vaughan, and Mississauga towards Oakville and Halton. And so it's one of the reasons that I have advocated there needs to be more consistency in the GTA of public health, because this notion that you can slice up the GTA does not function in reality. It may be good in theory, assuming that everyone would stay at home, but that's not what actually happens. And so I have expressed and continue to express concerns that that's a reality. And particularly with outdoor amenities, I have to say, Peel Public Health reached out to the province and said, open up our outdoor amenities, even under the stay-at-home order. And so here you have kids can't play outdoor hockey in Brampton or Mississauga or Toronto, but they can in Vaughan or Oakville or Markham. You can't go skiing in Peel Region. We got Mount Shinkuzi and the Caledon Ski Club, but you can go up elsewhere and go skiing. And so what I'm seeing is that you're seeing these people that want to enjoy the outdoors, that they're leaving. And so it's actually causing people to leave our region and cause exposure in other regions. And so, I'm not happy about an extended lockdown, but at the very least, that request from Public Health, which was based on science and data, that these outdoor amenities are low risk, at the very least, let us open our outdoor amenities. Let us, allow our residents to get physical fitness. It's good for their health, both physically and mentally. And if I'm highlighting frustration, it's because I struggle with the fact that some of these requests haven't been acted on. Is there a follow-up?
Oh, thank you.
Okay, thank you. Well, thank you everyone for tuning in today, and that completes our our update this week for the region of Peel and the city of Brampton on our efforts to combat COVID-19.